Welcome, everybody. I'm Jeff Chrissy. I'm editor of Commercial Carrier Journal, and we are pleased to have a long-lasting relationship with the Truckload Carriers Association in helping put together content for their Trucking in the Round sessions as a part of our partnership with the Commercial Carrier University. And what that is, in your seat, you'll have a little bag that has a USB in it. CCU is the educational outreach program that we do at CCJ. And on that USB, there are 5 separate manuals, how to use financial statements, how to evaluate equipment life cycles, how to write a business plan, how to manage cash flow, as well as how to plan for succession. And just one caveat, the 2015 tax code has not been updated for that, how to plan for succession. So if you do give the business to your son or daughter, don't use that, that kind of information for this year, certainly. But so those are the manuals. They certainly are great. They're popular at the Independent Contractors Association meeting. A lot of fleets like to take them and distribute them to their leased independents, and because they really are good in helping get a business off the ground. So feel free to take one or more with you as you leave today. And with that, I would like to introduce our speaker this morning, Kim Beck, who is Vice President of Benefits Consulting for Cottingham and Butler, where she specializes in providing strategic planning and compliance services for trucking companies. She has more than 23 years of insurance benefit industry experience and has been working exclusively with trucking companies at Cottingham and Butler for more than 10 years now. She's also helped develop a nationally recognized annual benchmarking survey for the trucking industry that provides comparative benefits and compensation data. So with that, I would like to turn the reins over to Kim.
Thanks, Jeff, and thanks for having me. And thanks for those of you that showed up this morning. Based on how many were in the bar last night, I think it was a good turnout. I talk a little bit fast, so I'm going to try and pace myself here as I go through this, but we'll probably end a little earlier than what the session time shows. I want to touch on just some high-level Obamacare topics, mainly because there has been some new reporting requirements and some other things that have popped up over the last couple of years that are very confusing for employers. But I'm not going to get into the weeds on it, so we can, talk later if you have specific questions about your company and how some of these ACA provisions are impacting you. But I want to talk about the ones that are specific to trucking, and then we'll talk a little bit about what we're seeing in the trucking industry in terms of costs and impact and recruiting and retention issues. I know everyone's having the challenge of trying to find and keep drivers right now, and benefits certainly plays into that, so we'll touch on some of that stuff. And then I'll talk at the end about what we're seeing for emerging benefit trends and what some companies are trying to do to get creative. So, as I'm sure you're well aware, you can take a look at the chart here and see, healthcare costs continue to be a major issue for employers nationally and for individuals and employees who have to pay the cost of health insurance. When we look at the trajectory of where costs are heading right now and where they've been heading over the past couple of decades, it's actually just really scary stuff. The bottom gray line is the overall inflation rate since 1999 up through 2014. The red line is the workers' earnings over the same period of time. The blue line is the health insurance premiums, and you can see that's gone up 191% since 1999, while inflation is 43%, 54% workers' earnings. But the workers' contributions to premiums is up 212%. So employers are passing along the costs, clearly, to the employees for health care. And we just can't sustain this. And thus the reason, everybody wants to fix this. And Obamacare, when it was first introduced, had all kinds of great theories on how that was going to happen. But what's really interesting to me is you can see the line went up exponentially after Obamacare was passed in terms of costs and passing along costs to employees. So as of now, we're celebrating our 5-year anniversary of Obamacare. Believe it or not, it's been a whirlwind for me and for our industry and trying to stay on top of it. But is it working? Is it here to stay? It appears to be. Since 2010, when it was passed, there's been over 50 challenges to the law, including trying to repeal the entire law, repealing the individual mandate component of it, repealing the employer shared responsibility mandate or penalties to employers for not complying, challenging the subsidies in the federal exchange states, as you, I'm sure, are aware, that didn't go through last week. Changing full-time employee definition to 40 hours per week instead of 30, adding copper level plans with higher deductibles, repealing medical device and Cadillac plan taxes. All of these things have been challenged. There's been many, many more. So far, all of the efforts to try and take some of these things back or modify them to any level of impact have failed. So really, what we need to do at this point is just focus on your efforts to stay compliant with it. So until we know that it's not going away, and for a long time there were a lot of employers who just believed wholeheartedly that this was going to get repealed and that it was not going to impact them, that it was going to change, and here we are 5 years later, we have to deal with it. So one of the things that I focus on with my clients is trying to find ways to contain costs, stay compliant, and in some cases try to get around some of the provisions, find loopholes. It's not for everyone. There's aggressive and there's conservative ways to try and get around these things, but cost-wise, everybody's facing the same challenges, so at least you're all in the same boat there. This stuff, all of the different components or provisions that have gone into place since 2010, it's overwhelming. Penalties for not offering coverage, penalties for not having coverage, waiting period restrictions. You no longer can have a 6-month wait or a year wait to get on the health plan. That's something trucking companies have used as a tool for years. Now you have to put people on your plans within 90 days or you can be penalized. You have to have annual open enrollment. That's something else a lot of trucking companies didn't do. If you didn't take the health plan when you were first offered it, you weren't able to get on again without a qualifying event. That little tool went away. New eligibility rules for employees and dependents. No more pre-existing condition limitations. You have to cover clinical trials. There's employer tracking and reporting requirements, out-of-pocket maximum limitations you have to abide by. We have to cover preventive care at 100% unless you're grandfathered. You have to cover 10 essential health benefits on your plan. Full-time eligibility now equals 30 hours. Changes to flex spending limits. There's the affordability calculation, that 9.5% everybody's aware of. The plan cost sharing of at least 60% to meet minimum value, the Cadillac tax. You have to track copays for drugs and office visits now toward your out-of-pocket maximum. That used to be able to be separate. We have new taxes and fees, the PCORI fees, the transitional reinsurance fees that employers have to pay every year, the new wellness program rules. I don't even have everything on here, and it's so much. So all of these things cost, and administratively too, to have somebody in your office or on your team that understands it well enough to at least be able to have an intelligent conversation with the broker about what you want to do to make sure you're compliant with all of these things. So, we know now that employees have gotten their first tax returns since the penalties took effect, and we're starting to see more and more employees coming to the employers saying, hey, I need to have health insurance now because I actually had a penalty for not having health insurance last year. They're aware that these things are really happening. This is a chart that shows what the fees are per person if you don't have health insurance. So for many years, there's lots and lots of drivers especially who would go without health insurance and they'd wait until later. They sometimes lived paycheck to paycheck, didn't want to pay the money to have it. Now they're seeing penalties on their tax returns and they're asking about it. So we will see participation on health plans go up. That's going to be a cost that most employers don't allocate for. So I'm going to talk about that a little later. But just so you can see what the cost is. So for 2015 this year, for those employees you may have or for those individuals who choose not to have health insurance and aren't exempt from the penalty due to income level criteria, they're going to be paying 2% of their taxable income, their adjusted gross income, in a penalty. So the maximum flat fee for a family is $975. So you think about, gosh, I either have to pay $1,000 to not have health insurance, or I can pay the $100 a month or whatever it costs to have health insurance and at least have coverage. You will see more and more employees picking up your plans. And that penalty steadily increases over time. So, be aware of that. The employer mandate, you all are aware of this, I'm sure. If you have 50 or more full-time employees, you are exempt from any penalties, or 50 or less, full-time employees, you're exempt from any penalties in 2015. But starting next year, that's going to impact everybody. In 2015, if you have 100 or more full-time employees, you have to offer health insurance that's affordable and meets minimum value, or face a penalty. The penalty for not offering health insurance, if you're an applicable large employer, is $2,000 for every full-time equivalent employee you have. And there is a calculation for part-time employees too. So basically for every 2 part-time employees you have, it equals 1 full-time employee for the penalty. You are exempt for the first 80 full-time employees. So just for easy math purposes, if you have 1,000 employees, you don't offer health insurance, you're going to pay a $2,000 penalty times the $1,000 full-time or 1,000 full-time employees you have minus the first 80. It's just a random number that the government's using, and that will go down to 30 in 2016. So if you're an employer with only 100 employees, the penalty's not that big of a deal, right? Because you're exempt on the first 80, so you're only going to pay a $2,000 penalty on those 20 employees. In 2016, it's still $2,000 penalty to not offer health insurance. All employers with 50 or more full-time equivalent employees must offer coverage to at least 95% of their full-time employees if you want to avoid penalties. Now, offering coverage doesn't completely negate you from penalties. The other side of the coin is if you offer insurance, but for some of your individuals it's not considered affordable or it doesn't meet minimum value, if those individuals go out to the marketplace and buy a policy through the Obamacare exchange and they qualify for a subsidy, you could be facing a $3,000 penalty for each person that applies to. I have another slide that I'm going to talk through that on. I really don't think it's a huge risk for most companies if you're setting your plans up appropriately, but you'll hear this a lot, the $2,000 penalty, the $3,000 penalty. For the most part, if you're offering a plan and it's affordable on at least 1 year plans, you don't have to worry about any of this stuff, okay? But are you guys going to make this available to folks?
Yeah, TCM makes it available for download for sure.
So you'll have all this stuff later to revert back to. The one big thing that I want to talk about with trucking and really for all employers is how to determine full-time eligible, because that's where the penalties are going to kick in. If you're not offering coverage to someone who's considered full-time eligible by IRS standards, that's where this $3,000 penalty could hit you. So determining full-time status, there's various methods for calculating and measuring this. In the simplest form, really, a full-time employee would be one who works an average of at least 30 hours per week or 130 hours per month. You can use either calculation, and there's various measurement options for this. There's a look-back period. There's a measurement period. I'm not going to get into a whole lot of detail on that today. Happy to explain that to you or help you with that if you want more information. Most trucking companies do offer health insurance to all of their drivers, but if you have a segment of drivers that it truly is part-time, we need to look at that and figure out how that works out for you, because if they're going out to the exchange and qualifying for subsidies and you're not offering them insurance and the IRS thinks they're eligible, you could be facing penalties for them. So some things to note when you're determining full-time status of drivers at the bottom. If you're using eligibility or charging for health insurance based on miles driven, days worked, loads hauled, percentage of revenue, et cetera, you really need to have a more reliable and acceptable method to convert these measurements into hours for ACA tracking and reporting. And I'm gonna just disclaim that by saying if you're offering health insurance and it's affordable and meets minimum value to all of your drivers, don't worry about this, okay? But if you do have a segment of drivers that you say, hey, you have to run at least 7,500 miles per month to qualify for health insurance, that could get you into some trouble if your drivers are running into areas where they're maybe only going an average speed of 45 or 50 miles an hour. So we have some calculators we use to help companies who use miles to determine eligibility, and we can make sure you're compliant with that. Again, kind of a rule of thumb is whatever you're doing on your 401k to determine who's full-time eligible, it's a similar calculation that you would use for conversion. So you need to create a formula that's reasonable to back into to convert those miles to hours if that's how you're doing it. Or, if you're using OmniTrax or other ELD, electronic log device systems, you can use that if you're showing hours worked that way. So again, you don't have to worry about calculating hours to track full-time and part-time workers if you know you meet 3 criteria. 1, you're confident you offer coverage to the required percentage of full-time employees. For 2015, you just need to offer coverage to at least 70% of your full-time equivalent employees. So you can literally have a segment of 30% of your people this year that you don't offer coverage to at all, and you won't be penalized for it in terms of the $2,000 penalty. But if those folks do go out to the exchange and qualify for subsidies, that's where a $3,000 penalty could come in. If your coverage meets minimum value, and I'll go through on a high level what that is again, most of you probably understand that. And then if your coverage meets affordability requirements. So if you're offering coverage to all drivers, for example, you don't need to worry about tracking hours. If you're not, you need to figure out who you're not offering it to and how you're determining whether or not they're full-time. And then maybe do some restructuring potentially to make sure that you don't get in trouble there with the not offering them coverage. And if you're not meeting all three of the criteria, you could be subject to a $3,000 penalty for any employee you have that goes to the exchange and ultimately qualifies for a subsidy there. So,
let me ask you, you said full-time employees and their dependent children, not their dependent wife, just their children?
so the question is, do we have to offer coverage to all employees and all their dependents? And does that mean children and or spouses? So, and I have a slide on this, so I'm going to talk about this again. The IRS rules do not require that employers offer coverage to spouses. But starting in your 2015 plan year renewal this year, if you're not at least offering coverage to employees and their children, you can be penalized. So there's no requirement to offer coverage to spouses, and a lot of people don't fully understand that. UPS announced a couple years ago that they were going to do the spousal carve out, and everyone freaked out, and there was all kinds of media attention around, oh, UPS is no longer going to cover spouses. That wasn't exactly accurate. They put in a spousal carve out that just said if the spouse of a UPS worker has coverage available through his or her employer, they have to take that coverage. But if they didn't, they could still be on the UPS plan, right? But the reality is you don't have to offer coverage at all to spouses. So you can do a form of a carve out like we just talked about, or you can just say, and I have 3 trucking companies right now as clients that don't offer coverage to spouses at all. They offer it to employees only, and then this year with their renewal are offering it to children because they have to.
So if they don't offer it to the spouse, then what if the spouse goes out into the exchange?
Yeah, so the question is if they don't offer coverage to the spouse and they go out to the exchange, what happens? Nothing to the employer. You cannot be penalized for that. So they can go out to the exchange, potentially qualify for a subsidy based on household income and the fact that they don't have coverage offered to them, but you can't have a $3,000 penalty imposed on you because you're only responsible for offering coverage to the employee and the children.
Does the children, the pricing for the employee and the dependent children pricing have to fall under the affordability of a single employee?
So the question on affordability, I'm going to answer in 2 slides, I think. No, but you're like leading into all of my slides, so it's perfect. Yeah, that's perfect. So meeting minimum value first, because this is confusing for a lot of employers, and then we'll talk about affordability, because those are the 2 big things. Meeting minimum value, and maybe you've heard about the 60% cost sharing. I've ran into a lot of employers who think 60% cost sharing or minimum value has something to do with their plan design and then how much they charge for coverage. Absolutely false. So meeting minimum value and that 60% cost sharing component of it, minimum essential coverage and minimum value coverage, has only to do with your plan design. So your deductibles, your out-of-pockets, your co-pays, having a drug card, what the cost sharing is in the plan if they use the insurance. That's what the 60% is. So what you charge employees has nothing to do with meeting minimum value. That's the affordability calculation. This chart just has a high-level kind of overview of what you need to comply with. So the first is there's a requirement that you have to cover 10 categories of coverage: maternity, rehabilitative, and pediatric, mental health and behavioral health, preventive and wellness, hospitalization, laboratory, prescriptions, ambulatory, emergency. Now, I'm going to disclaim that because those 10 categories are required under the individual policies that are offered under the exchange and on small group policies and on fully insured policies, but they're not required for large employer, large self-funded plans, and large group fully insured plans. So, and this is again one of those loopholes if you're looking for ways around things. As a large employer, if you have a self-funded health plan especially, or if you have over 100 employees on your health plan and you can convince your Blue Cross Blue Shield or United Healthcare or whoever your carrier is to allow you to carve out different coverages, you are not required to cover essential health benefits. Or if you're a grandfathered plan. Less than 20% of plans are still grandfathered out there today. So that doesn't really impact a whole lot of people. But I'm going to give you an example on this, the 10 categories of coverage, because a lot of brokers tell you have to cover all these things. That's not actually accurate if you're large. So one of the things we're seeing carve out of where we see these skinny plans, if we offer a skinny plan, a low-cost plan, we meet minimum essential offering of coverage and minimum value. Well, the government just changed on this, how you calculate things, and they're requiring that you cover inpatient and major hospitalization services. But you can carve out mental health. You can carve out substance abuse. You can carve out certain services that maybe conflict with your company culture or philosophy, especially substance abuse. So although the IRS rules say you have to comply with covering the 10 categories of essential health benefits, if you're a large employer or self-funded, there's some leeway there and flexibility. The next thing is the limits on cost sharing. So you can't have any cost sharing at all if you're a non-grandfathered plan for preventive care services, including contraceptives, which has been a big deal in the media. You know, Hobby Lobby had a big lawsuit over it. So unless you're a religious organization and you get an exemption, you have to cover all preventive care at 100%, including contraceptives. You cannot have any annual limits on essential health benefits. So if you have essential health benefits covered, you can't have any annual dollar limits on those benefits. We used to have that, ability to play around with health plans and say, okay, we have a $10,000 annual maximum on prescriptions. So if you spend more than $10,000 a year on prescriptions, you cap out, our plan doesn't cover it. Those are some of the creative things we used to be able to do, we can't do anymore. No more dollar limits. You also...
mental health?
You can, and especially mental health. If you cover mental health, there's what's called the Mental Health Parity Act that says if you cover mental health, you have to cover it like any other service. You can't have higher copays, you can't have different deductibles, you can't have dollar maxes, you can't have visit limits. So be careful with that. And I still see that in plans that are non-compliant. You can't have any lifetime limits on any essential health benefits or on your plan. It used to be you could have, $1 million lifetime annual maximum or lifetime maximum. So someone who is catastrophic that hit $1 million of cost would be capped out. Your plan would no longer cover them. You can't do that anymore. You can't have a cap on out-of-pocket costs that goes above what the IRS limits are. So for 2015, $6,600 is the most that an individual on a health plan should have to spend on out-of-pocket costs, all inclusive of copays, coinsurance, deductibles, drugs. And then in the end, you plug all this stuff into a calculator, which I'm going to show you here in a second. And if your plan meets minimum value and the government says you cover at least 60% of all the costs of the services that someone would have on your health plan, you pass, okay? So again, cost sharing, the 60% refers to plan design only, not what employees pay. You probably can't see any of this, but I just wanted to give you kind of a snapshot of what the minimum value, the actuarial value calculator looks like from the Department of Health and Human Services. So we as a broker and your insurance carriers take your plan design and we plug all this stuff in for you. And at the bottom it spits out what's the metallic value of your health plan, right? So it has to be at least 60%. So at the top we start off with, we put in the medical deductibles, the coinsurance, the out-of-pocket maximum, the drugs, is there deductibles, are you covering emergency room, are you covering preventive care, are you covering lab, outpatient, x-rays, all the different components of your health plan. We plug them all in, check the boxes, and then we look at what your value is. So in the yellow you can see, if you're a bronze level plan, it's at least 60% actuarial value, you pass. So as long as you have a plan that's at least a 60% actuarial value, and it's affordable. That's all you have to do to avoid penalties. You can offer a silver plan, a gold plan, a platinum plan, and you can charge a fortune for those and make them super expensive. Doesn't matter which plan people take. As long as you offer a plan that meets the 60% cost sharing and it's affordable, you're safe from penalties. So if you're wondering how you come up with these actuarial values and the cost sharing, there's a calculator out there. Your broker should be able to plug that in for you or your insurance carrier and tell you where your plan falls on that. So before I get to affordability, any questions on the 60% actuarial value or meeting minimum value?
What did you talk about a minute ago when you said it was a maximum of $2,600?
$6,600 is the individual out-of-pocket maximum, is the highest you can have for an out-of-pocket max cap unless you're a grandfathered plan. So you have a deductible, you have coinsurance, and then you have an out-of-pocket maximum. For 2015 plans that renew, you can have up to $6,600 out-of-pocket maximum per individual. $13,200 for family is the cap.
So if you have let's just say you have a copays, and so the copays are gonna be up to what level?
So the question is, if I have a $5,000 deductible plan and I don't cover any of the copays under the deductible, and then there's copays after the $5,000. So how that would work is for the first $5,000, they're responsible. Then copays kick in. If they're paying a $50 copay for an office visit, all those copays add up. They can't have more than $6,600 total out-of-pocket costs with copays, deductibles, and coinsurance in a plan year, or you can get in trouble. So you have to have that secondary limit or out-of-pocket maximum for those copays, either built onto the plan or into the plan, or you have to cover those copays below the 5.
Does that out-of-pocket include prescription?
So in 2015, so it didn't have to until 2015 now when your plan renews. So if you're a calendar year plan, it should already be in there. If your plan hasn't renewed yet in 2015, you're going to have to do it this year. The question is, does that have to include prescriptions? Yes. So it has to include all copays for prescriptions as too. This is a big deal. Because always in the past, it's been you could keep going on those prescription copays. You know, if people have 8, 10 different prescriptions that they take, they're going to max out on their deductible or out of pocket just on drugs. So there's the creative things you can do with your deductibles and out of pockets and have separate out of pockets for drugs versus, office visits and deductibles and coinsurance. But yeah, together combined, they all have to fall within.
And who tracks that?
You have to track that.
Is this one of the systems that we've got to bring in to do all our tracking?
So if you're fully insured and you're with Blue Cross Blue Shield or United or Cigna or Aetna, they're doing that, and they should be not allowing you to have a plan that doesn't. If you're self-funded and you're working through a TPA and you're building your own plan, it's really up to you and the TPA and the broker to make sure that your plan is compliant with all of that. But that administrator of your claims or of your insurance policy tracks it. So determining affordability, I get a lot of questions about this too, and I'm going to talk specific to trucking here on a couple things, but the employee cost for single coverage must not exceed 9.5% of adjusted gross household income. So you have no way of knowing somebody's household income, right? You know what your employee makes because you have obviously the payroll information for what you pay them. You don't know if they make money elsewhere. But I'm going to talk about that in a second. But if the coverage is not affordable and meeting that 9.5%, and again, it doesn't matter what you charge for dependents. You can charge the entire difference for adding a spouse or adding children, but the affordability calculation is based only on the single cost of coverage. It doesn't matter what you charge for family coverage, just for what it costs for single coverage. That's the 9.5% calculation. So if your coverage doesn't meet that calculation, I'm going to talk a little bit more about this here in a second, 3 criteria must be met before an employer is subject to the $3,000 penalty. So 1, the employee has to choose not to elect the coverage you, as the employer, offer them pre-tax, out of their paycheck weekly, check a box and sign here, easy to sign up for, right? I mean, they have to say, no, I don't want that. And then they have to say, I want to go out to the exchange and go online on the Obamacare site and sign up for a plan and pick from 12 different plans and understand it all and then get through the system because the website's been broken. And then they have to qualify for a subsidy based on their income. So, for example, as an individual making $35,000 a year is not going to qualify for a subsidy if that's their adjusted gross income. So all 3 things have to happen. All the stars have to align before you, as the employer, can get triggered with a $3,000 penalty on that employee. And if it does happen, that $3,000 penalty is prorated by the number of months that they've worked for you. The first 90 don't count. So you're not, the likelihood of having to pay any of these penalties and what it's really going to cost you is slim to none, and it's a low risk. And for most employers, a $3,000 penalty on an employee or 2 is not a big deal when you consider the fact that you're probably spending way more than $3,000 for the people on your plan. So I always tell my clients, don't be so afraid of this penalty risk, right? Don't make your cost of insurance so low because you're so scared of this calculation that now everybody's on your plan. So there's a fine line and there's a balance about how you want to set up your plan and structure this to make things work. I always say, if you offer a high deductible, low cost plan, low cost, $150 a month, for example, you're going to probably be free of any penalty risk in the trucking industry. And it doesn't matter if anyone takes it. You can offer 3 different plans, and as long as one of your plans that you offer is affordable and meets all the other criteria, you're free from penalties. And they can choose to spend more. And they may go to the government and say, well, it's not affordable to me because I chose the $500 deductible plan that costs $200 a month. Doesn't matter. You had availability of a $100 a month plan. You chose not to take it. So there's a lot of flexibility here in what you can do as an employer to avoid penalties. So again, affordability is based on household adjusted gross income. So you have no way to determine household income. So you can, if you want to have a safe harbor calculation and figure out where you're, stratify your risk for your employee population and what you pay them, you would look at their Box 1 income on their W-2s. And what's interesting about Box 1 income is, this is, so if you offer a 401k and they are putting money into their 401k, if they have any other deductions that come out pre-tax, Box 1 income is taxable income. So don't confuse this, because if you're a company that pays per diem, as an example, per diem does not count as taxable income. So the affordability calculation only applies to the taxable income. So here's a chart just as an example. If the driver's annual gross pay is around $45,000 and you're paying them per diem, which equates to around $15,000 a year, which would be pretty close to an average per diem, if they're over-the-road drivers, their taxable annual income is only $30,000. So you may have a broker look at your salaries and say, oh, your average driver makes $40,000, $50,000 a year, you're safe. But if you're paying the max per diem, and that brings their adjusted gross income down, and anything else brings their adjusted gross income down to that Box 1 level where it's a lower amount, now you need to do a different calculation for affordability for your safe harbor. So if their taxable annual income is $30,000, and the affordability calculation is 9.5% of that number, that means that annually your cost of coverage can't exceed $2,850 for your lowest cost plan, or you could face a penalty if that person goes out to the exchange and buys a policy and all the stars align. The equivalent weekly premium for health insurance is $55 for that calculation. Most of my trucking companies offer something in that range or lower anyway. Drivers make good money, but you also have to look at, do you have, dock workers? Do you have admin people making $20,000, $22,000 a year? You may have some affordability issues with them. So just keep that in mind when you're stratifying your salaries. Figure out where your risk level is based on what you're charging for your lowest cost plan. And then, do you need to adjust or not? Most of the time I tell people, take the chance. If 10 people could have a situation where your coverage isn't affordable and they're not taking it, so what? Don't adjust your premiums for everybody because of 10 people. Do something else, or just pay the penalty if it happens. Again, they have to go out to the exchange, buy a policy, qualify for a subsidy, pay for their coverage, and then a year later it has to be determined and you get hit with the penalty for however many months they worked for you. So don't be super scared of it. Unless you just want to be off the radar with the IRS completely and make sure everything's safe harbor, which there's some of those too. So again, you can use a single rate for the lowest cost plan offered as long as it meets minimum value. And a lot of people don't know this. If you have a differential in premium of tobacco and non-tobacco, you can use your non-tobacco rate. So you can use your lower discounted rate for your affordability calculation. So what a lot of my clients are doing is, we'll just offer a non-tobacco rate that gets us in the safe harbor, and we'll charge a whole lot more for tobacco because 50 or 60% of our drivers are smokers, so we'll collect enough premium that way. You can play around with that. Be careful though, because if you also do a wellness program, which I'm a big advocate for, you can have wellness discounts in there, but unless you have a separate discounted rate for non-tobacco, not built into wellness and all the other stuff, you can't use that discounted rate. So you either need to use your standard rate or your non-tobacco rate to determine affordability. So I'm going to get off of this and move on to the next slide unless anyone has questions on affordability.
My biggest fear would be the per diem side, that you don't know. Some drivers do it very well, and some drivers don't. And so let's say you had a driver that was at $35,000, but he has per diem of 15, and now brought him down, to 20. And then you go, okay, now what do we have? And does it qualify? And what you're basically saying is, let it ride and don't worry about it and see what happens.
I don't want I don't want to say don't worry about, let it ride. But again, going to that example of the per diem, if a driver's making 35,000 gross, he's not running very many miles. Make sure he's full time, and then, or maybe you need to give him a rate increase, and then you knock off the per diem, and it brings it down to 25,000. Yeah, you could have an affordability issue potentially, but again, this is a driver who has to decide. You know how much they hate paperwork and going online and doing things? You think they're going to say, no, I don't want your coverage that I can check a box for. It's super easy. And I want it pre-tax out of my check every week because I'm horrible at cash flow and budgeting. They're going to go to the exchange, sign up for coverage, pay for it, qualify for a subsidy, figure all that out. I'd say the risk is low. I don't want to say don't worry about it, but the risk is low. And I don't mean to stereotype drivers. I love drivers, but it's a different group of people. They think differently, make decisions differently than the white collar. So just understanding them will help you get a little more comfortable with your risk.
Kim, you mentioned about the importance of wellness programs. Can you talk about how a stringent wellness program, I know that Prime certainly is a champion in that area, how that can impact the healthcare coverage?
Yeah, wellness programs in the trucking industry are super challenging. And one of my favorite things to do and talk about and build strategies around. But long term, if we don't do something as an industry, if all employers don't get on board like Prime and some of the other great champions within your TCA group for sure, and doing things like the TCA challenge and Lean for Life on the road and all those great things, and sending wellness coaches out to meet your drivers and understand how they live and their lifestyle. And if we don't do that, these guys are turning over whether you like it or not. They're going to leave you, go to somebody else, maybe come back. If everybody did the same thing and focused on better wellness programs that actually worked within our industry, it would help lower healthcare costs. Because let's face it, you guys have the highest risk group of employees in the country. I mean, they're sitting in their trucks all day, average age of 48, smokers, they don't eat well, they don't, it's a tough risk. So to answer your question on what can we do with wellness, that's a whole separate presentation I'm happy to do. But we have seen return on investment with programs done right. So I'll talk a little bit at the end about accountability-based structuring. I'm a firm believer that if you're going to invest in a wellness program, do it more like a stick than a carrot with regard to your health insurance premiums and your benefits. But having the other stuff, the tools and resources, the coaches, the on-site clinics, and the challenges through your company all year long that people can do to lose weight and stay active, and all of those great things are awesome, and I think people do really appreciate having them. If you have a really high turnover group, it's hard to justify investing time or effort in those programs. So, it's a catch-22 with trucking, especially right now. So, anyway, getting back to proving that coverage was offered and meets minimum value and is affordable for every employee. Just some high-level bullets here. If the lowest cost plan offered is affordable, no penalty can be imposed. Again, we can't use wellness discounts in our calculation. That doesn't mean you shouldn't do it. Only the cost of single coverage can be considered, so it doesn't matter what it costs for dependent coverage. You don't have to offer coverage to spouses. You do have to offer an annual open enrollment, and you have to be able to prove that an offer of coverage was made. I want to point that out because this is different going forward. Not only are you going to have to prove that you offered coverage, you're not going to have to track and report on it, which I'm going to talk about next. It's a big deal. So communicating with drivers is not easy. They don't read stuff you send to them in the mail. They're on the road for 2 weeks at a time. Maybe don't even ever get the stuff you send them. So how are you going to prove that you offered them coverage is something you should be thinking about as an employer. Benefit admin systems and using your satellite message systems and having intranets or smartphone apps or anything like that you can think of that you're making sure you're reaching out and communicating with them. And you can say, hey, we've done our due diligence. We've made every effort to communicate. We've offered the coverage. If you don't have a signature on file that they elected or waived coverage, long-term could be a problem. Okay, right now you're okay, but starting in 2015, which this will impact you at the end of this calendar year, there are new reporting requirements where they're going to start making sure that you're offering coverage to everybody, or who you should be, and if you're not, that's where the penalties can kick in. So new I hate this part of my presentation, but I have to talk about it, is the IRS reporting requirements that you're all going to have to figure out how to handle this year. 6055 and 6056 is the tax code. And so there's 1094, 1095 paper forms or electronic forms that are going to be due. If you're filing paper forms, and I'm going to explain what these are, high level. If you're filing paper forms, those are going to be due February 29th of 2016 for your 2015 calendar year. So this is where it's going to get confusing for employers who have plans that renew in July or October. If you're running an off-calendar year, fiscal year plan, this reporting is calendar year. So don't confuse that. It's based on a calendar year of plans and who's on it and enrollment and all of those things. The electronic forms, if you don't do paper forms, are going to be due March 31st. If the applicable large employer, ALE, sorry, applicable large employer, those with, for this year, 50 or more, or 100 or more, next year, 50 or more employees. If you're filing 250 or more W-2s, this is similar to, you guys know now you have to report the value of health insurance on the W-2s. If you file more than 250 of them, this same thing is going to apply. If you file more than 250 W-2s, you're going to have to file electronically for this reporting, so you can't even do paper forms. And then the 1095 individual statements that are going to have to be mailed out to employees, very similar to W-2s, are going to be due by February 1st. So I'm going to talk about this here a little bit more.
Are you saying that that number that we're putting on this form is not going to tie out to the calendar year? I mean, it's not going to, yeah, if I have a mid-year plan.
So the mid-year, the question is on if I have a mid-year plan, does the number tie out what I put on the W-2? So two separate things. The W-2 value of coverage, it doesn't matter what, if you use your plan year or calendar year. You can calculate that number, whatever makes sense for you, as long as it's consistent and you can show how you've done it year over year. That goes in the W-2. This reporting is going to be calendar year reporting. So just two separate things. And how this is going to work is, really, the new reporting requirements are meant to do two things. One, the individual mandate reporting and penalty under the section 6055 is verification that that employee has offering of minimum essential coverage so that they don't have a penalty. So the first part of it is, do I, as a person, have health insurance? Yes or no. Does it meet minimum value? Yes or no. And if the answer is yes, then I don't pay a penalty. If I have a health insurance policy like a mini-med or a limited medical policy and it doesn't meet minimum value, I can have a health insurance in my mind, but I still pay a penalty. And I'm bringing that up only because if you have independent contractors, and there's a lot of programs out there offering limited medical plans and all that within those association deals, those don't meet minimum essential coverage. Those don't meet minimum value. So your contractors, and you're promoting this great program you have, and we have them at Cottingham and Butler too, we're very cautious about this. If that program you're offering the contractors has a limited medical plan in there, disclaim the heck out of it that doesn't necessarily get you out of the individual mandate penalty, okay? So that's the one form. The next part is the employer mandate reporting, where you have to verify that you met all the employer shared responsibility mandates. So you're offering coverage, it's affordable, it meets minimum value. So you're going to be reporting on all that and explaining it to the government. And then you're going to confirm whether or not that individual is eligible for a tax credit. So what's going to happen here, the reason for all these forms, and I'll talk about them a little bit more here in a second. The form for the employer that goes to the government that says, we offer health insurance, it meets minimum value, here's all the number of people we offered it to, and here's everybody that had it and every month they had it for. Like, this is seriously detailed reporting. There's another form that goes to the employee that you have to send out to the employee, or the insurance company has to send out to the employee if you're a small group or if you're fully insured, that I then take to my accountant now this year, because it's always been self-reported the last couple of years. I take to my accountant now next year when I file my taxes, it says, I don't have a penalty because here's my proof that I had coverage. And then finally, all of those individual forms that you send to those employees, you also have to send that information to the government so they can tie it. So now when that employee goes to the Obamacare exchange, in theory, ideally, and they sign up for a policy and they say, I get a subsidy because my income is low, now the government can match up their name to the forms that they received from the employer they worked for, verify the income, verify whether or not the employer offered coverage, and say, yep, that person's telling the truth, they deserve the penalty. Or cross-check and go, no, don't think so, nice try. We're taking away your subsidy. And that's happening to people. So if they say they qualified for a subsidy self-reported and the government checks it, they take it away. Now they won't have to check it anymore because the systems are supposed to talk. By the way, none of this stuff's built. Okay, so this is all in theory. Long term, there'll be a system where this all talks, right? But this is a step one into getting there, to having all this reporting starting and getting the employers used to doing this, and they have some way then of cross-checking.
How do they handle if you have multiple W-2s and they had insurance with one on one and didn't have it on the other?
So multiple W-2s and they had insurance with one employer but not the other. For the individual, the penalty, they don't get penalized if they had insurance, right? For the employer, if they offered coverage, it doesn't matter which employer they chose it with. If you offered them the coverage, it gets you out of the penalty.
They might have only taken the insurance with one employer but not the other three.
Right.
The other two, and then how does that handle?
So how, COBRA?
You know, I mean, if they were offered COBRA.
So these reporting requirements also show anyone who's on your COBRA. So it's not just who's on your health insurance as an active employee, it's former employees and how many months they had COBRA insurance under your plan, and all that stuff is tracked and reported now. This is not going to be fun. So this, if you haven't looked at this yet, get on it. You've got 6 months or less to figure it out. So here's the different forms. So you got 1095A, and this doesn't apply to you as an employer because this is really for those people who buy insurance through the marketplace. That those forms have to be sent by the marketplace to them. There's 1095B for health coverage and 1095C. So 1095B would apply for those either individual or small group plans under 50 employees. They get a 1095B. If you're a large employer or self-funded, or you have 50 employers or more, it's 1095C. So this, I don't know that it matters a whole lot, just so you know you're doing the right forms, okay? For most of my clients, it's 1095C forms are the ones you're gonna have to worry about. These forms, the intent is to provide documentation to the individual employee about their company-provided group health insurance to file with their tax returns, like I said. It gives the IRS documentation that they're going to eventually, hopefully, tie into a system somewhere that talks. It's going to assist them then in determining whether or not you really should or shouldn't be penalized as an employer for that individual employee or for all of them. It's going to also help them determine if your company employees are full-time or eligible, or if their dependents are eligible for tax credits. So I had a question earlier about, well, what if we don't cover spouses and the spouse goes out and gets a tax credit? That's okay. This is going to help to determine if they should get one or not. Doesn't necessarily mean you're going to be penalized for that. So this applies to fully insured and self-funded. So don't think because you're fully insured that your insurance company is going to do this. This is your responsibility. So this is an example of a section of the form. I don't know, you can't really see this, but you got the name, the social security number, the address, and for every single month, so you've got to have all the people you cover, and for every single month, how many months they had coverage for, right? This form is complex. So really the question is, how are you going to be collecting this data? Payroll vendor is your best option. So if you're, and by the way, ADP just announced that if you hadn't signed up for their special portal that you could plug in to do all this, they're done. They are so overwhelmed with this, they aren't doing it anymore. So you lost your opportunity to get their module. So there's lots of payroll vendors out there offering this service. There's lots of third-party vendors offering this service. The government did its own calculation estimating how long this is going to take for completing these forms, and they figure approximately 13 minutes per form. So you have 500 employees, that equates to 108 hours just to complete these forms. This is just one piece of it, because you got the employer summary form, you got other stuff too. And that's assuming you have good access to data through your system. Because you have to show who, not just who's on your plan, but you have to figure out how many people you offered coverage to. So if you have a high turnover group, and you have, 25% of your employees who never elected your coverage, you still have to track whether or not you offered them coverage and report on it. So what I love most, this cracks me up, the government created this form that are supposed to be sent out to the employees with the social security number right next to the name and address. So guess what? You know how you can send your W-2s out in a window envelope? You can't do that with these, because you're going to violate HIPAA if you put social security numbers out in public, access in an envelope that has a window. So be careful. What you can do, this may help you, you can put this in with and behind your W-2s. So when you mail out your W-2s, you can stick this in there behind them. You can also use truncated social security numbers on the forms you send to the employees, which would allow you to use a window envelope, but you can't use truncated social security numbers on the forms you send to the government. You always have to put full social security numbers on anything you file with the government. So if you don't do this, if you just ignore it, whether you mean to or not, the penalties are big. So for every individual statement that you fail to send out to your employees, there's a penalty potentially of up to $100 per tax return with a maximum penalty of $1.5 million. So make sure you're sending these out and make sure you're sending them to people at the right address so that they get them so that you don't get a penalty imposed on you. So before I get off of this, I really flew through that, and I have a couple separate pre-recorded webinars we've done on this reporting that I'm happy to share with you. Come take my card after and email me, and we can get you some links so you can watch those. Or if you get invited to them there's attorneys doing these, the IRS does webinars on it. Go to one, because there's so much more that I didn't touch on these. And the tracking and reporting part is not going to be an easy, simple task. So, did you have a question, Oi?
Back to the $3,000 penalty. So if all the stars align and they do qualify, when is the state going to send the fine notice, or have they started doing that?
Yeah, so the question is on the $3,000 penalty and when does that start hitting us? Because that doesn't take effect until 2015, it can't affect you as an employer until 2016 when after tax returns are filed. So what's going to happen in 2016, around February, March, all these tax returns are going to be filed, and individuals who qualified for subsidies are going to trigger the government to then look at who was the employer that guy worked for or that girl worked for. Were they full-time? Did that employer offer coverage or not? Was it affordable to them? And if the answer is no, and all those stars align, now the government's going to come to you and say, can you complete this and verify, is this accurate? Because their systems don't talk yet. And then they're going to calculate and tell you how much you owe. And that's when you can, as an employer, dispute and say, no, what, we don't think we owe it, and here's why. Because they didn't choose our affordable plan. We offered an affordable plan. They didn't like it. So they chose to go to the exchange, but we had one that was affordable. Because if employee says, well, yeah, but the $500 deductible plan that I really wanted cost $300 a month, I couldn't afford it, they didn't report accurately. But that's why this reporting and all this filing is going to go to the government so that they can cross-check it now. And that's why they delayed the penalties, because they knew they had no way to check. So that's why the penalties will start to impact you now for this plan year, because there's reporting on it.
If they finally get their act together, then maybe go back like 4 or 5 years.
So the question is, if they get their act together, will they go back 4 or 5 years? They cannot retroactively penalize beyond the 12 months following the filing of the tax return. So no, they're likely not going to be able to do that and get away with it. Now, I say that doesn't mean they can't try or that they won't. The government has different rules for themselves than they do for everything else. So who knows? That's not written. So I'm just going to do a summary of everything we just talked about with compliance, and then I'm going to move on to some other stuff. How are we doing on time, Jeff?
We got about 12 minutes.
Okay. So offer a plan that meets minimum value. Offer at least one plan that's affordable. Maintain good records. Implement a quality system for tracking hours and communicating with those drivers. Work with your broker and your payroll vendor to ensure you're compliant with plan design, that it meets minimum value, your annual reporting requirement. Consider purchasing a benefit admin system if you don't already, because that will help with a lot of the stuff, especially if it ties into your payroll. There's some great ones out there. Workterra is probably one of my favorites. Understand how your plan and cost compare to your trucking peers, because if you're overspending on healthcare coverage because you're worried about all this other stuff, and now all your competitors out there have higher deductibles than you or charging more than you, and they're not getting penalized or being hurt by any of this stuff, now you're putting yourself in a position where you're spending more money on healthcare than you should be, and you could be taking that money and spending it somewhere else to help with your recruiting and retention. So I'm going to talk about that next. Do you know your company's benefit package and how it stacks up to your competitors? Some people do, some people don't. There's great information out there. But if you look at Mercer survey data, which is one of the great survey survey reports out there on employer-sponsored coverages, they have a segment for transportation, which tells you deductibles and costs for transportation industry. However, it includes buses and rail and airline and all of these very heavily unionized segments of the transportation industry, and in my opinion is very skewed and not accurate to trucking like we know it. So we have, Cunningham & Butler built, and Jeff alluded to this earlier, a compensation and benchmark survey. This was my baby about 8 years ago, and it's grown every year, and we have more and more motor carriers that subscribe to it and put in their data every year so that you can see how your benefit package compares to your peers. And so understanding how they stack up is really important for a couple reasons. One, we know that compensation is typically number one on a driver's list for what's important to them when they choose a company to work for, right? Or why they stay. So pay is number one. Then there's home time, your quality and the age of your equipment, the labor involved. Is it touch-free freight? Are they loading, unloading, tarping? Are they climbing up on tanks? Where they drive. Are they Upper East Coast in heavy traffic metro areas are also very important factors when a driver looks at where they want to work and why they leave a company. And so the third point I'm going to make here is, and this is what I do, so I'm not trying to, make light of what I do, but while the benefit package you offer is super important to your drivers, they want to have benefits, it's not, number one on their list. It's probably not even number 3 on their list, but it's in the top 5. So offering an overly competitive package and spending too much on it is taking away dollars that you could be spending on those other things that are going to help you recruit and retain drivers, which is becoming more and more of a challenge every year. I don't have to tell you that. So what you may already know is what an average deductible looks like, what average costs are, what average premiums are for employer or employees in your industry, and against all industries. You might know how your plan compares against those averages. If you don't, Mercer surveys is a good survey. Your broker should have access to that. Cottingham and Butler does an annual benchmark survey. We just went to the printer a week ago with our reports. We're going to have those out next week. I had a stack of them to bring with me, and I was going to hand them out to those lucky people who came to my session, and I left them at home, but I do have an electronic version with me if you want to peek through it. And if you participated in the survey, you'll get a very nice bound, glossy printed report with all the information in it. If you didn't participate, I can still get you in so you can get a report. But know how you compare, and I'm going to give you a little snippet of that here on the next slide. What you may not already know is the 7 different metrics that impact your health plan costs, and I'll talk about that briefly, how your numbers compare, the cost of these metrics, and what you can do to improve them. Everybody gets, I can shift my deductibles, I can shift my co-pays, I can charge more money, and that's how I can save money. That's not saving money, it's shifting money, right? But there's other things you could be doing, a deep dive in your health plan to save money that you may not be looking at. So first, at a high level, I'm going to fly through this because we're running out of time. The average deductible in the trucking industry is $2,500. And what's interesting is that the average deductible on an individual nationally for all employers of all sizes, all industries, is $1,500. So we know that trucking companies can get away with having higher deductibles and slightly higher out-of-pocket maximums. You can get away with having higher office copays because all your peers are doing it. Your competitors are doing it. Now, keep in mind, these are medians, right? Or averages. So there's a lot of times there's as many employers that have better plans and worse plans as this is the middle. This is taking them all plans that they offer, do a blended weighted average based on enrollment of what those plans look like in the trucking industry. And at the bottom, I don't know if you can see this, monthly employee rates. And this, you probably charge weekly, so don't get confused on here. But the monthly rate for a single coverage on a health plan in the trucking industry is $173 for non-tobacco and $217 a month for tobacco. While the rest of the industry standard, isn't to have tobacco, non-tobacco necessarily, or at least Mercer doesn't report on it, is $177 a month. So we saw last year, and on family, $680 a month, $750 for tobacco. We saw those rates from last year to this year on our survey go up anywhere between 15 and 30%. And what's interesting to me about that is actual costs of coverage only went up about 5%. So employers are taking the opportunity to blame Obamacare and raise their rates and finally shift some costs because everybody else is doing it. And so if you're not there, you may want to think about doing it too. The average gross cost per employee is $8,000, almost $8,200 in the trucking industry. It's over $10,000 for all industries. And here's the reason: because they have $1,000 lower deductible. They have $25 office copays instead of $30. They have richer plans. They cost more, right? The trucking industry has been ahead of the curve in shifting those costs. So the net cost per employee, which is after you collect money out of the employee's paychecks, and now what's my actual cost to the company for every employee that takes my health plan, is $4,900. So you're spending about $5,000 for every person that takes your health plan. So I'm going to jump back to that $3,000 penalty for a minute. That $5,000 is a tax deductible expense. The $3,000 penalty is not. So there is some, it brings it closer together. But what's really important here is that $5,000 per employee is per those that enroll in your plan. So we know that enrollment's going to increase because of penalties. People are afraid they're going to have to pay a penalty if they don't have health insurance. So they're going to start jumping on plans. Do you know what your cost per eligible employee is? That's the number you should be benchmarking with your benchmark groups and tracking, because you're going to see that number change. So for every employee you have eligible for your plan, right? So if you have 500 employees and only 300 are taking your health plan, and you figure it's $5,000 per employee for those 300 taking your health plan, you're missing the boat on calculating what the risk is on the other 200 not taking your plan. So if you take your total health plan cost and divide it by the 500 instead of the 300 and get to a net cost per eligible employee, that's the number you need to start tracking and watching, because it's going to change and go up because more people are going to take your plan, right? Is everybody following me on that? Talking fast. The metrics that you should be looking at, though, participation, which is what I was just alluding to. How many people take the plan? What's your dependent ratio? So for every employee that elects coverage, how many bodies are they bringing with them? If you have a really high dependent ratio, it's costing you a lot of money, and there's things you can do to shift that. What are your medical and prescription claims costs per member, and how does that benchmark? It matters. What's your demographic index? This is the hardest thing to impact, especially in trucking, because demographic index is your average age and your gender split. So we know that an average age male of 49 on a health plan, for example, which is your drivers, is going to cost way more than a female at any age, except for maybe 25 when they're having babies. So if you have a high, heavily dominated male population of employees on your health plan and they're older average age, your demographic index looks horrible. The administrative cost percentages, what are you paying for fixed costs in your health plan, which are largely driven by all your other stuff? Employer plan cost percentage and employer contribution percentage. So this is what we call the 7 metrics. We do a 3 C's, a deep dive. We look at coverage, consumption, and cost sharing. And when I say coverage, most people go, okay, that's what Blue Cross Blue Shield, what's my deductibles? When I talk about coverage, I mean who are you covering and what do they look like? Not what do they look like physically, but what does that demographic look like? So how many people take it? What's the dependent ratio? How many bodies are they bringing with them? How much are you spending on the ones that are taking it? Are you spending too much on fixed costs? What can we do about the demographic index that's impacting that? And then what are you sharing in terms of the cost when they use your insurance? And what are you sharing in terms of the cost out of their paycheck? You should be looking at all of those costs. They all have a dollar amount assigned to them. And what's interesting is that it's very different in trucking versus all other industries. So when I look at, for example, the average participation on a health plan, all industries nationally, about 80% of employees elect the coverage their employer offers. In the trucking industry, it's only 76. That 4% swing is a huge number for dollar-wise for costs. If you just figure out $5,000 for every employee that doesn't take your health plan and it's 4% lower than the national average, you're saving money over the national average industry, right? But how do you compare to your peers? Again, I go back to if your plan is too rich and everybody's taking it, it's costing you, because if your competitor only has 76% taking your health plan and you have 90, you're spending a hell of a lot more than your competitor, on health insurance. And, it's money you could be allocating somewhere else. So know your numbers. The dependent ratio is pretty similar to all industries. The demographic index is the big one. So what this is saying is that in trucking, the demographics, the average age and the mostly males, is 22% more costly than the average employer. You can't help that, right? You need good drivers, and the best ones are the older ones. They're more experienced. They're willing to run the miles. But there are things you can do to help how that impacts your costs. So know where you're at with it. And then the plan cost sharing is basically how you design your plan, and the contribution is how you charge for the plan. So once you know all those numbers, you can start to tie dollars to it. And here's a quick example. Trucking company A has a 5% higher participation rate than the average trucking company. So we know that that's, if you have 500 employees and we know that you're spending $5,000 a year for everyone that takes your health plan, that means that having 25 more employees than the benchmark would have is costing you $125,000 more than you need to be spending if you want to benchmark at the average. So you're doing something that's driving more people to elect your coverage, making it richer, whatever. Where they could be taking spouse coverage or staying on a parent's plan or whatever the case may be. So the potential savings there, it could be $125,000. I have a bunch of things you can do to impact this, and we do this for every metric. So I'm going to fly through this because we're about out of time. You can do eligibility audits to make sure that the people you're covering, the dependents you're covering, the spouses you're covering are actually eligible for your plan. You would be shocked at how many people will lie to get on your health plan, and it's the ones who lie to get on your health plan that are going to cost you the most because they're doing it for a reason, right? So you have and I don't want to pick on drivers, but sometimes they have 2 or 3 ex-wives. If they're paying family coverage anyway, because they have kids on the plan, they'll leave the ex-wife on, even though your plan says that you don't have to cover an ex-wife. They may leave them on and not tell you they got divorced. There's a lot of things that go on. I've seen girlfriends who change their last name to match the driver's last name so that they can look like a spouse and that the employer won't question it so they can be covered on health plans. All of that stuff costs money. So knowledge is power. Take the next steps. Understand how your overall benefits and costs compare to the national averages. Evaluate your 7 metrics. Determine the costs or savings that impacts you on those. Explore and implement strategies that can move your numbers closer to or lower than benchmark to cut costs. You can use that money to spend it somewhere else. And this is super important. Train your recruiters on how to spin the positives, okay? Usually healthcare and what you offer in trucking isn't that great when you compare it, especially when you're hiring dispatchers or, key white collar people, because they have better coverage probably available through other places or have seen better coverage. But for your drivers, spin the positives. If you do have a better plan and you're going to continue to spend extra money to have it, spin it. Make sure you're getting your dollar, your bang for your buck out of it. And communicate using social media and videos. These drivers don't like to read stuff, right? But they love pictures. They love, hearing maybe videos or sending out satellite messages. Just keep tidbits in front of them about all the positive things you're doing. But make sure your recruiters know they have a cheat sheet and know how to spin the positives about your benefit package. And then, just a funny little, I can't afford that diagnosis. Do you have a cheaper one? There's no magic bullet, silver bullet that I can give you other than to just know all your numbers and then see where you shake out. There's a lot of creative strategies out there. This is my last slide. We're seeing more and more employers self-fund to mitigate ACA cost impacts. We're seeing spousal carve-outs becoming more the norm or no spousal coverage at all. Eligibility audits, finding and terminating participants on your plan that aren't really truly eligible based on your plan language. Opt-out benefits and Medicare education programs. If you still have, 70, 75-year-olds on your health plan, there's things you can do to help educate them on Medicare and supplements. You can't financially incentivize them, but there are creative other things we can do. I'm not going to get into today to help people opt out and take other coverages instead of yours and get that participation rate down. High deductible health plans, HSAs, consumer-driven plans are now becoming standard offerings. Carve-outs or specialty networks, narrow provider panels in your PPO networks. There's other things you can do behind the scenes that aren't super impactful to employees to get better discounts on your claims. PBM, which is like a PPO network for your drugs, you can have better contract negotiations. I see so much fat and waste on PBM contracts and what's happening with the drugs on the back end. It's crazy. Closed formularies, not covering specialty medications, all kinds of strategies out there that you can still do. Steerage to walk-in clinics or using telemedicine, teledoc, eliminating the office visit copay off your plan, saving money on that, and sending everybody to the telephonic. By the way, access to care is going to be a huge problem. More and more people that have health insurance are going to use it, right? Doctors are going to become less and less available, and they're going to spend less time with your people. So there's ways you can offer telemedicine and smartphone apps where they can have a video chat with a doctor. Lots of cool things out there. Defined contribution or private exchanges if you just want to be completely out of the health insurance administrative business and say, I'm going to give you $200 a month. You go buy your own insurance. I don't want to deal with it. There's options for that. I'm not going to talk about this today, but Cost Plus or Medicare-like rate plans, we're seeing up to 40% savings on health plans through some very aggressive new strategies on healthcare and health insurance through what we call Cost Plus. And then accountability-based plan structures, and Jeff asked me earlier about wellness. Tying your premiums to participating in a biometric screening or health coaching, or scoring a certain number on your wellness or meeting 5 criteria to be healthier. Making them pay more if they don't versus and then rewarding people that do the right thing, that's where health plans are headed and where we should be headed more in the trucking industry for sure. And there's ways to do that it doesn't have to be an investment, and there's ways to do it where the employees don't necessarily feel like it's invasive. Some of them always will, but I think this is really important if you want to control costs long term. And then voluntary supplemental benefit offerings and leveraging those supplemental benefit offerings like critical illness and accident policies to help, and if you talk to your broker and negotiate, to take commissions from that and help pay for enrollment suites or Ben admin systems or call centers to take some of that administrative work off your plate and give drivers access to someone they can talk to live on the phone and enroll in benefits or ask questions. So this is kind of what we're seeing going on out there. I just threw a lot at you really fast. Questions? Because we're out of time.